Sure. Sure, I'll be happy to. Well, the German Chambers of Physicians, for them, patient safety and quality of medicine, of course, one of the most important tasks. And we continuously work to develop and improve the environment, the working environment for physicians in order to help them serve their patients the best they can. And we came here to Skopje in Macedonia in order to meet our colleagues from all the medical chambers, the physician chambers in Central and Eastern Europe, to share our experiences, how we try to improve the working conditions and working environment for physicians to ensure patient safety. And we had very interesting talks here. We presented from the German Medical Chamber our system of quality assurance and patient safety in Germany. We had a presentation where we gave a few examples how we do that in order to share our experience in that field. Sure. We have certain different institutions that deal with the topic of patient safety. One institution takes care of the environment in hospitals, for example, to accredit hospitals that fulfill all the criteria for patient safety. Then we have systems for the ambulatory environment and also for other healthcare institution facilities. One example, for example, would be the critical incidents reporting system, which is a system that should help physicians to share critical moments where they could see that an adverse effect could happen, an effect that wouldn't be good for the treatment of the patients, but it didn't really happen, but they were afraid it could happen in that situation. So they can report that through this system, it's usually done online, and share this experience with other physicians so they can learn from their colleagues how these adverse events can be avoided.
Do the patients in your country are introduced with their rights and with this system that is going on between the physicians? Do the patient know what's going on in the system?
Sure. I mean, first of all, the relationship between patients and physicians, that's the most important, the trusting relationship. Because on that mutual trust, the whole treatment is based on. And we always, of course, keep the data of patients most confidential. And the system I just described is a totally anonymous system, both for the physician that reports these adverse events, but also for the patient, of course, it is totally anonymous.
Thank you very much.
You're welcome.